Governor Murphy, when you're ready.
Thank you, Michelle. Good afternoon, everybody, and thank you for being with us virtually today. I just got to do one thing with my screen here. Bear with me a second. Hold on. There we go. Thanks for being with us virtually. I can't say the woman on my right because she's not on my right, but she is on the right of my screen, the woman who needs no introduction, the Commissioner of the Department of Health, Judy Persicelli. Along with her today, we have the head of the Department of Health's Department of Communicable Disease Service Medical Director, another familiar face, Dr. Ed Lifshitz. Hey, great to have you back, Ed. Another guy who needs no introduction, Superintendent of State Police Colonel Pat Callahan. We have Chief Counsel Paramel Garg and a cast of thousands. First up today, this morning, I signed an executive order for all flags to remain lowered in honor of the late Senator Bob Dole until sunset tomorrow. Senator Dole was an American hero, a member of our greatest generation who so often reached across the aisle in politics to do what was right for our nation. He was a fiercely proud Republican, but he was an even prouder American. There's a lot to be learned from his example for all of us. I was speaking to Tom Daschle the other night, and he reminded me three huge landmark pieces of legislation. I won't go through the details, but he did them with respectively Tom Harkin, George McGovern, and Teddy Kennedy, the guy who put his country first, so God rest his soul. Now let's move forward. Last Friday, we announced the first confirmed case of the Omicron variant in New Jersey, a Georgia resident who was traveling through New Jersey on a return from South Africa. We suspect that by now this is not the only case of Omicron in our state. I think Judy will go through the fact that we've got at least a handful of others that are pending, either being sequenced or pending sequencing. And as researchers continue to look more deeply under the so-called Omicron hood, there is still much we still do not know conclusively regarding its transmissibility, virulence, or the impacts of the vaccine. We are hearing more and more anecdotally about each of these factors, but we all need to be patient and let science give us definitive answers. This morning, we did receive encouraging news with the release of a study conducted by Pfizer, which suggests that a booster dose of its vaccine provides similar levels of antibodies to combat Omicron as the initial two-shot regimen showed against the prior strains of the virus. That is encouraging, without question. But in the meantime, our lived reality is that the Delta variant remains overwhelmingly, I would almost say near exclusively, the variant of concern in New Jersey. We do know its transmissibility, we do know its virulence, and we do know that the vaccines are highly effective against it. So as we bring up the latest vaccine numbers, there you can see on the screen, we encourage everyone to continue seeking out opportunities to get your booster shots. And we're going to be opening up several more mega sites in coordination with both Judy and her team and Pat and his team to help get these shots in arms as soon as possible. So the last time we were together, basically 10 days ago, I said the added protection of a booster is not a bonus, it's a necessity. That statement is even more true today. And the early data of the ability of the Pfizer vaccine in particular to enhance protection against Omicron bears this out. 1 week from today, Judy, it's hard to believe, we were standing shoulder to shoulder at University Hospital. It'll be the 1-year anniversary of the first vaccinations against the coronavirus here in New Jersey. The best way we can celebrate this milestone is by getting our boosters. And to help facilitate, making it easier, Judy and her team are making next Wednesday Boost NJ Day. And I know she'll have more on this in a few minutes. As we look to the overall performance of the vaccines, we see that they continue to perform exceptionally well in protecting vaccinated individuals against the infection, hospitalization, and death. This is now, remember, this is our entire lived history with the vaccines from January 19th through November 29. And I think even more relevantly, here are the preliminary numbers for the week of November 22nd to November 28th. This is preliminary data, but it's important to get a real-time snapshot, which shows that even as some individuals' protection may have begun to wane, which is the reason why, by the way, everyone needs to get a booster, the initial vaccination courses continue to perform very well. Let's now go to the rest of today's data. And starting today, we're going to do things a little bit differently than we have for many of these briefings. Instead of the one-day numbers that we had been showing, we're going to give you week-long look-backs for new cases, hospitalizations, and deaths. And so as we have moved back to the once-a-week briefings, and by the way, we'll be back with you live unless you hear otherwise this coming Monday. But as we moved to the once-a-week briefings, and frankly, even before, the one-day snapshots we had been presenting lacked a lot of context. We're hopeful to better frame the data by showing them against the prior week so you can see the ebbs and flows as we have. And we hope that this will not only put these numbers in a proper perspective, but also hammer home the reality that everyone needs to get vaccinated and then get boosted. We know the overwhelming majority of our new cases, new hospitalizations, and new deaths, sadly, are from among the unvaccinated. And as we turn now to the number of cases, as you can see, it becomes quite obvious that we have experienced, as we expected and predicted, a post-Thanksgiving spike. There's no other way really to look at these numbers. The combination of colder weather, going indoors, and then layering on top of that a uniquely American holiday, we believe that combination is what's driving what we're seeing here. So from these, we cannot let our guard down, especially if you aren't vaccinated and if you're in a crowd, whether it be in a store buying presents or in a bar or a restaurant or at a party. It is safest and wisest to mask up, especially if you do not know the vaccination status of those around you. And as would be expected from a surge in new cases, our hospitalizations, or hospitals rather, are also seeing a surge in new COVID-related admissions. Now, surely our numbers across the board are roughly 1/3 of what they were a year ago at this time, thanks to the vaccines, I might add. But keeping our healthcare system strong and capable of caring not just for COVID patients, but everyone else who needs care remains of paramount concern. The burnout that our nurses and doctors and other staff members are experiencing after now what is basically 21 going on 22 months of the pandemic cannot be overlooked. Next up, here are the newly confirmed, with the heaviest of hearts, I might add, deaths going back since last Monday. And look at today in the context, again, of the past 9 days. Moreover, sadly, it is very, very likely that most, if not every one of these deaths, or at least the majority of them, could have been prevented through vaccination. Now, as we always do, let's honor the lives of 3 more of those who we have lost. First up, we'll start by remembering Woodland Park's Phyllis Mestaso. Phyllis spent 42 years as a registered nurse at St. Joseph's in Patterson, then continued her career at an adult daycare center in Nutley and at a private practice before retiring. But even then, she kept busy by volunteering at St. Joseph's, where she was also a member of the Nurses Alumni Association and volunteering with the Little Sisters of the Poor in Totowa. She was predeceased by her first husband, John, in 2003, and her second husband, Lawrence, in 2016. She is remembered today by her children, Anne Marie, with whom I had the great honor of speaking last week, and Vincent, and their spouses and families, including grandchildren, Allison, Amanda, James, and Leah, along with many other relatives and friends. And by the way, James works at the Motor Vehicles Commission for the state of New Jersey. We thank Phyllis for a lifetime spent in service to others, and may God bless her memory and the family she leaves behind. Next up, we honor this gentleman, Eugene Fitzpatrick, a longtime resident of both Livingston and East Hanover. A retired database administrator for Foster Wheeler and then Novartis Pharmaceuticals, Gene played guitar and was a huge fan of the Rolling Stones. Excuse me. He loved summers on Long Beach Island. And in the autumn was an avid, long-suffering Jets fan. He was also a Corvette buff and a proud member of North Jersey's Natural Glass Corvette Association. Gene was sadly predeceased by his son, Michael, to whom he was a devoted dad. In addition to his wife, Cindy Lou, with whom I had the great honor of speaking last week, he left Michael's mother, Catherine, along with his daughter-in-law, Heather, and an incredible number of family and dear friends. We are honored to have called Gene a Jersey original, and may God bless and watch over his memory and the family he leaves behind. And finally, today, we remember Mirba Vega. Mirba Vega. She was among the many Cuban refugees who sought to build a new life in Union City, where she settled with her husband, Antonio, after the owner of a local bakery sponsored their passage to the United States and to New Jersey in the 1960s. While raising her and Antonio's 5 children, Mirba worked part-time as a cleaning lady. She would later drive a bus for the Hudson County Vocational Technical School. She was a renowned cook and was the heart of her family, post she fully reclaimed after a bout with breast cancer. She left behind her husband of 57 years, Antonio, and their children, Sandra, Alexis, Alexander, Tony, and Mimi, and I had the great honor of speaking with Mimi last week. She also leaves behind 5 grandchildren, Jennifer, Alexander, Tyler, Christina, and Massimo. She also left many other friends and family, both here in New Jersey and back in Cuba and around the world. When I was speaking with Mimi, this is one of these families, the Vega family. Not only did they lose Mirba, but they were crushed with overwhelming loss. Mimi said she lost her mom, obviously Mirba, her uncle, and 2 cousins, one in Jersey and one in Cuba. We thank Mirba for enriching our state, and we hope she found her American dream right here in New Jersey. May God bless and watch over her and the family she leaves behind. And may God bless and watch over all we have lost over the past 21 months. Now, let's give a well-deserved shout out to one of the businesses who were among the first to partner with the Department of Labor through our Return and Earn Employment Incentive Program. Jackson-based Roosters Roundup provides individualized child daycare to match every client's needs and foster their social and educational growth. Over the past year, Roosters Roundup grew considerably, including for the purchase of a Seaside Heights daycare center that broadened their reach. Administrator Tiffany Calderese knew Roosters Roundup would need to bring on 5 new staff members to meet the needs of both patients and kids. And through the Return and Earn Incentive Program, she was able to not only receive the funds necessary to hire and train these new child care professionals, but each of the new hires received a $500 signing bonus. I caught up with Tiffany last week to thank her for being an example of how Return and Earn can help us on the road back. And I know that kids throughout Ocean County are in good hands. When I asked Tiffany what she thought of Return and Earn, and I'm quoting her, she said, it was a breath of fresh air. Check out Roosters Roundup. You can find them on Facebook, by the way. It's an outstanding organization.